AMR is a big issue. Is a third world war. We must curtail AMR, antimicrobial resistance. What is AMR? AMR is antimicrobial resistance. The microorganisms which were once sensitive, they are becoming resistant to antimicrobials. It's a big issue now. If you see, our body is having more than 10 raised to power 14 cells in our body. And out of this, 90% of our cells are microorganisms. And by use of antimicrobials, we are killing these useful organisms. They are useful in our body. 90% of these microorganisms are useful for our body. They help us in digestion of food. They help us in producing enzymes. They help us in producing vitamins. So they are useful. But unnecessary use of these antimicrobials, we are killing these useful organisms, which need to be protected. If you see the data, very alarming. 4.5 million, around 45 lakh people have died because of AMR in 2019. And if we see the Indian data, more than 10 lakhs. Out of this 45 lakhs, 10 lakhs people died in India because of AMR in 2019. And the common organisms which we find during infections, these are the bacteria which are getting resistance. Most common bacteria which cause infections are E. coli, Klebsiella, Staphylococcus aureus, Acinetobacter, Mycobacterium tuberculosis. And these are the bacteria which are getting the resistance. So you can think of what is a problem. And key drivers of this AMR are inappropriate use of antimicrobials. And you cannot see antimicrobial resistance in silos. The misuse, overuse of antimicrobials are causing. But you have to see the infection control practices also. Poor hygiene practices. If the infection is not going to happen, there will be no microorganisms to kill. So we have to control the infection also. So poor hygienic practices. Then easy availability of antimicrobials. Over-the-counter availability of antimicrobials. Lack of enforcement of law agencies. Cross-border spread of resistant organisms, like we see in COVID. People are moving around nowadays. People from one country to another country. There's so much of movement of people are there. If somebody is resistant to one organism and he travels, he spread the infection to other countries also. Over-reliance on empirical treatment. You can see that we are accustomed to writing antimicrobials. If we see any infection, we start writing an antimicrobial. So over-resistance to empirical, because the study has been found that 90% of our infections are viral in nature, where there is no use of antimicrobials. There is no use of antibiotics, but we are writing antibiotics. Another important aspect is you need to have newer antibiotics. Whenever this resistance develops, you need to have new antibiotics. Yes, before 1985, we had no issues on that regard. Whenever microorganisms, bacteria were getting resistance, and new molecules of antimicrobials are available with us. But after 1986, there is a dearth of it. We have not got any new molecules, and resistance is developing. So it's important that there's a research and innovation should happen. There's a dearth of new antimicrobials. So we do not have any new antimicrobials to kill those organisms. So that is another drawback on this issue. You cannot, as I said, you cannot work on antimicrobials, or you can talk of antimicrobials without talking of resistance developing in animals, resistance in environment. That's also becoming important. As happens in human being, we are misusing antimicrobial. The same is happening in the animal world also. Veterinary doctor also, without any issues, they are giving antimicrobials. they have to be used judiciously also, even in agriculture also, because they feel that animal growth is good in that, so they are using these antimicrobials. In the agriculture, the same way these are being used. And when these antimicrobials are used in agriculture, they are using animals, and many of our non-vegetarian, vegetarian, we all take food, animal food or a plant food, this goes into us also. And similarly, and all these are passing in the environment also through our urine, through our water, they are coming into the environment, and that water we are drinking, which is having antimicrobials. So AMR issue cannot be tackled just tackling the human issue. It has to be tackled as a one health issue where we have to take into consideration the animal health, we have to take the plant health as well as the environmental health. If all these issues are tackled together, only then we can eradicate the menace of antimicrobials. What is the impact of this AMR? Because unless until we see the impact, we will not find a solution. The impact is very alarming. Because we are not able to treat infections, so there will be increased morbidity, mortality, more stay in the hospital, and more staying in the hospital, you can think of this economic loss also, and there is a social loss also. Then we have gained so much of modern medicine. We have cure cancer, we are using organ transplant, but if these infections happen, you can see all these modern medicine which we have advances, we have got so much of advancement in modern medicine, this will come to standstill because of infection. We will not be able to do any organ transplant. It will not be successful. We will not be able to treat cancer patient because they will be dying not of cancer, but they will be dying because of infections. So all these things has to be taken into account, and same will happen in the animal health and environment also. So all these things have an impact. Antimicrobial resistance is not curtailed. The challenges, as I said before, the challenge is the same as the effect are. These challenges are because of weak health system, lack of resources, diagnostic facilities are not there or not being used properly. There is a inappropriate use of antimicrobials. Proper infection control practices are lacking. Lack of access to clean water at many places not there. And more important, limited investment in developing new antimicrobials. As I said before, previously, pharmaceutical companies were into this. 1986, before that, we had no issues. New molecules were coming, research was easy, but after that, the investment is so much that pharmaceutical companies are not ready to put their money into that. So somebody has to come. The government resources has to be pulled in for research so that we are able to have new antimicrobials. And another important issue which I have discussed before are overuse and misuse of antimicrobials in animals. Now, what can be done? Something has to be done. Word over. There is a global action plan. So on the same line, we have formed a state action line also, a state action plan also. What we have to do in this state action plan? Awareness and understanding means communication and training, knowledge and evidence. That will be based on laboratories and surveillance. You all people are very renowned people are there in front of me. You have attending this. So you have a lot to do about diagnostics facilities, making them it easy for the patients to get it, and doing the surveillance also, monitoring also. What is the trend which is there? Third most important is state infection plan is infection control and prevention. Fourth important pillar of state action plans is optimizing the use of antibiotics, not only in human being, but in animals also. Then is research and innovation. As I said, unless and until we do research to find out new molecules, AMR will continue. So we have to do research and innovation. If we do not bring new antimicrobials or do not use it properly, in 2050, by 2050, it is predicted that there will be another pandemic, which will be of AMR. More than 10 million people, means around 1 crore people will die because of antimicrobials resistance. And if you see during COVID, which has made so much of cry and we got so many human loss was there. There was 70 lakh people died. Just think of 1 crore people dying every year after 2050 because of AMR. So something has to be done now. So please incorporate state action plan seriously. And then collaboration. Collaboration between scientists, collaboration between different associations, collaboration between animal, environmental, and human health physicians. This is very, very important. I feel hospitals are the main source where antimicrobial resistance is very, very important. Because here the patients are coming, which are infections. We are using antimicrobials in large numbers. Here, monitoring is very, very important. I think one important project which can be started in all hospitals is AMR Smart Hospitals, where the infection control practices and judicious use of antimicrobials to be monitored. That can really bring down the infection rate. Sometimes we always feel that it is the duty of a government. No, as individuals, we all are sitting here. We also have a duty. We can, at our level, we have to think of what we can do is adopting antimicrobial stewardship, giving drugs, giving antimicrobial in right doses, right time, right way, and judiciously. Enhancing in our own network surveillance activity, which we can do. Infection control practices, not only for ourselves, but also advocating for our patients also. Doing a community engagement program also in infection control practices and teaching our patients also that they should not use antimicrobials of their own. Only on prescription they should use. We can also engage pharmacists that they should also not prescribe antibiotics. They should not give antimicrobials without the prescription. Participate in capacity building, as you all have come here. Organize such activity yourself also, so that we increase the knowledge among our clinicians, among the general public also, that the meanness of antimicrobials, what it can cause. Advocating state action plan. And many of you, please do research and innovation. You can do your research, you can do your innovation. Laboratory persons are here. You can do, we can have simplified culture methods. We can have more molecular methods to use, which can give the results fast. But as you know, at present, these diagnostic tools are very costly. So we have to do research so that they become economically viable for general people also. So there's a lot to do. 1928, a very important date, when Alexander Fleming has introduced penicillin. First time some antimicrobials has come. And by 1985, we have no new molecules of antimicrobials. So a lot need to be done. We can save humanity by just having one important thing: judicious use of antimicrobials, infection control practices, and doing research and innovation. Let's educate, advocate, and act now. We all together, if we come together, we can make a difference. Thank you so much.